Hello, everyone. If you can hear me, please type it in the chat box. I want to make sure my sound is working. Great. Thank you all for attending our active employee and non-Medicare retiree general medical plan overview webinar. We'll start with a pre-recorded overview. Your microphones will be muted during the presentation, but feel free to type any immediate questions you have. Our representatives are here to help. After the presentation, you'll be able to hear your questions answered by our representatives. Let's get started.
Jay, are you able to queue up the video? Sorry about the technical difficulty, folks.
Welcome to the San Francisco Health Service System Open Enrollment webinar. We're so glad you've joined us today to learn about your benefits for plan year 2025. The open enrollment period is the time each year when all members can enroll in benefits or change their current benefit coverage for the upcoming calendar year. During this period, you can change from one plan to another, waive your coverage, add or remove dependents from coverage, and enroll in flexible spending accounts. If you do nothing, your current benefit elections will roll over to the next plan year. However, flexible spending accounts do not roll over. Eligible members must re-enroll in the flexible spending accounts every year to participate. All new benefit choices are effective January 1st, 2025. Here are some key dates for plan year 2025. Open enrollment starts at 8 a.m. Pacific Time on Monday, September 30th, 2024, and ends at 5 p.m. Pacific Time on Friday, October 25th, 2024. You may enroll through the e-benefits portal on the San Francisco Employee Portal. Paper applications must be postmarked by October 25th, 2024 to be accepted. During the webinar, all attendees will be muted and off camera for the entirety of the presentation. We encourage you to ask questions at any point during these presentations. To ask a question, open a chat box by clicking on the chat icon in your menu bar. You may find the menu bar either at the top or bottom of the screen, depending on whether you are using a computer, a mobile device, or a tablet. We will answer as many questions as time allows during the Q&A portion of the presentation. Important. Please do not share personal medical information in the chat. All chat text is viewable by all attendees, and we recommend a one-on-one consultation if you have specific personal concerns. If you have a question that includes personal or private medical information, please schedule a private one-on-one consultation with our health plan vendors during our open enrollment office hours for SF-HSS members, which can be found at sfhss.org/OE2025. If you have eligibility questions, please call SF-HSS Member Services at area code 628-652-4700 or visit our offices at 1145 Market Street, 3rd floor, during our business hours listed on the screen for further assistance. And lastly, we want to remind everybody to get their annual flu shot and COVID booster to protect yourself and your loved ones during this fall and winter. And with that, our presentation will now begin.
Well, good afternoon, everyone. Thank you for joining us today for this webinar to kick off your 2025 open enrollment. As you may know, this is now the 4th year our Health and Canopy Care HMO plan is being offered, and we're excited that you've joined this webinar to learn more about the plan and all the wonderful programs that come with it. But first, quick introductions on the speakers. My name is Fred Reyes, and I'm representing HealthNet. And with me today, I have Emma Welch, who's representing our Canopy Care HMO Medical Network. Next slide. So I'm going to hand the presentation over to Emma now to walk you through the partnership that was created between HealthNet and Canopy Care. So Emma, I'll turn it over to you.
Thank you. So Canopy Health is a network offered through the HealthNet Canopy Care HMO plan. So the Canopy Health Network offers an affordable pathway to some of the best healthcare systems in the Bay Area. It includes 5 medical groups, as you can see, John Muir, Hill Physicians, Skippa, Dignity Health, and Providence, as well as 30 hospitals and over 80 urgent care centers. As you can see on the map to the right, we span over all 10 Bay Area counties, so from Sonoma, Napa, all the way down through San Francisco to Santa Cruz County. What's new this year, Canopy Care continues to be one of your most affordable options while still providing access to high-quality healthcare. As far as our network, the UCSF and John Muir Health Cancer Center opened on the Walnut Creek campus this past February. It's a beautiful facility. And then the UCSF Bayfront location opened in San Francisco last month, so August. And then there are some new telehealth services that Fred will go over later in this presentation. So Canopy Health offers an alliance referral program, which allows you to go outside of your primary care network with a referral from your primary care physician. So this gives you access to the entire Canopy Health network to find a specialist that is right for you or to get a second opinion. So it offers a bit more flexibility. First, you'll meet with your primary care physician, and if deemed necessary, you and your doctor will discuss options within the network. Once that referral is sent and approved by the group's referral department, then you are free to schedule your own appointment. And then if you do have any questions specifically about the Alliance Referral Program, there is a dedicated email that's included on this slide, as you can see, so challiancereferrals@canopyhealth.com. And then I'll hand it back over to you, Fred.
Thank you, Emma. All right, so next we're going to talk about behavioral health solution that we offer our SFHSS members. So when it comes to access to care, we have you covered. We have over 20,000 in-network providers with over 5,000 of these providers that accept both in-person and virtual care, a 24/7 call center, and also integrated care management, which means that if you ever need higher level of care, both your primary care physician network and therapists would work together to provide you with some whole person care. Next slide, please. And so here's a quick glance at the benefits. Important thing to mention that no referral or authorization is needed for outpatient office visits. So as you'll see here, that's a $25 copayment for outpatient therapy. Higher level of care, again, inpatient care in a hospital, detoxification, that would require an authorization, and that's a $200 copay per admit. And then outpatient services, that's things such as alternate care, partial hospitalization, day treatment, inpatient physician visits. That also requires an authorization, but that's covered at 100%. So no cost share for members. Next slide. And so in the next couple of slides, we'll cover our wellness programs as well as our value-added programs, which are free or zero cost to our members. So next slide. So a couple of important items we want to cover first before we get into these programs. All the programs that we offer can be accessed online at www.healthnet.com/SFHSS, and members can register to access all the programs. So first up, we have our Real Age Test. This is a personal health risk assessment where you can earn up to a $50 gift card just for taking the test. and up to $50 more for completing some other online health activities. Next, as Emma mentioned, we offer teledoc virtual care at no cost to our members. And this is great when traveling or if your regular doctor is not available. You can talk to a healthcare provider over the phone or video. And sign up information is listed here on the slide, but it could also be found on the website. And next, we have Wellbe, which is our decision support program that helps members decide on, prepare for, and recover from surgery. And members can also earn a $25 gift card just for completing a couple of the program modules. Next slide, please. And so when it comes to behavioral health wellness programs, we also have you covered there. We provide some great self-help tools and programs to help our members improve both their mental and physical health. So first up, we have My Strength, which provides in-the-moment mood tracking. It also provides instant stress relief actions that can help a member achieve lasting and healthy changes. And next, we have our Unwinding program, which uses mindfulness to help our members build resilience. Members are able to use it throughout the day whenever they find themselves feeling stressed or if they need a quick dose of calmness. And through the use of breathing exercises, meditation, sleep support, visual relaxation, and more, members can start living a less stressed life. Next slide, please. And in these next couple of slides, we'll go over what you can expect when changing plans. Next slide. So one of the most important things to keep in mind is that you will be automatically assigned to a primary care physician under our plan. However, you have up to 90 days to make a correction if needed. If your provider and or medical group under your current plan are also contracted with Health Net, all you need to do is just ensure that any authorized services taking place in the new year are either submitted to Health Net or updated by your medical group. Members will be eligible for continuity of care. So this means in certain circumstances, you may be able to continue care with your prior health plan provider. And the last point we want to call out is it's non-urgent appointments can be very hard to come between the period of January and March. So therefore, it's always a good idea to schedule an appointment and confirm availability of your doctor as soon as you can. Next slide. And some pharmacy program basics. Again, we strongly encourage all of our members to get familiar with the new formulary, identify prior authorization requirements, any cost differences there may be. Also note that any prescription authorizations or clinical criteria notes do not get transferred to the new health plan. So if you did go through that process with the previous health plan, in order for that to be a smooth transition and avoid any issues, we always recommend that you try and complete Health Net's prescription transition forms located under our website. And that applies to prescriptions as well as self-injectables. And that'll allow the authorization under your previous health plan to carry over to the health plan. And next up, one final important thing to remind you about is our open enrollment office hours. This is the opportunity for you to schedule an appointment and talk to one of our customer service agents about any questions or concerns that you have about the plan, or if you're considering making a switch. Next slide, please. So as we close, we just want to summarize on why someone would want to consider choosing Canopy. And again, we provide affordable access to some of the best hospitals and medical groups in the Bay Area. Easier access to specialists through Canopy Health's Alliance Referral Program. Canopy is a network of choice for many doctors, nurses, and their families all around the Bay Area. And finally, Health Net's whole health member-centric programs and services that support our members' physical, behavioral, and emotional well-being. So this concludes our presentation. We just want to say thank you for your time today, and we hope you found this presentation helpful, and we wish you good health in 2025. Thank you.
Good afternoon, and thank you for joining today. My name is Adam Gunther, and I am a Senior Account Service Representative here at Blue Shield of California. In this presentation, I will be going over, at a high level, the Access Plus, Trio, and PPO plans. I'll also be going over some differences between the three plans and the additional programs available to HSS members in 2025. What's new for 2024 open enrollment? For the Access Plus and Trio HMO plans, as well as the PPO plan, there are no medical plan changes for 2025. The benefits you have for 2024 will be the same benefits you'll have for 2025. All three plans will have a new and improved pharmacy experience, which will require new ID cards. On the PPO plan, HSS has chosen to add Blue Shield Connect. This will replace the services you may have previously received from Accolade. and all PPO members will be assigned a new group number and a new member ID. Now let's take a quick look at the Access Plus and Trio HMO plans. SFHSS members have the option between two HMO plans, the Access Plus or the Trio plan. The Access Plus plan and Trio plan benefits remain the same from 2024 to 2025. Both are HMO plans which require you to choose a personal care physician or PCP. These PCPs are associated with an independent physician association or IPA, or are often referred to as medical groups. Members must stay within their chosen IPA for all services. Both Access Plus and Trio plans are copay driven. The benefits for both the Access Plus and Trio plans are the same, with the network being the main difference between the two. The Trio network is a subset of the Access Plus network and is only available in select regions of California, whereas the Access Plus network is Blue Shield's full HMO network and is available throughout California. There are no deductibles, only fixed co-payments for most services like doctor's visits, urgent care, and emergency care. Both plans have access to virtual care with Teladoc. There are mental health benefits to help with depression, mental illness, and alcohol and substance use disorder. Convenient access to extensive pharmacy networks, including Safeway, Vons, Costco, and CVS. And personal assistance from Shield Concierge, our team of healthcare experts, to find doctors, transfer medical records and prescriptions, and answer any healthcare questions you might have. Taking a high-level look at the benefits for the Access Plus and Trio plans, you'll see the benefits are the same. As I advised on the previous slide, the benefits are the same for both plans, with the network being the main difference between the two. Both have no deductible, with an out-of-pocket max of $2,000 individual and $4,000 family. Both have a $25 copay for PCP visits, a $30 copay for specialist visits, with lab work and Teladoc at a $0 copay. Outpatient surgery in a hospital is $100 per surgery, and inpatient hospitalization is $200 per admission. Both have a chiropractic and acupuncture benefit at $15 copay per visit, up to 30 visits per member per plan year each. There is no pharmacy deductible for either plan, with retail drug co-payments of $10 per generic, $25 for formulary brand, and $50 for non-formulary brand. Programs only available to the Access Plus and Trio members include Shield Support Care Management programs, which provide nurse support, home visits, self-management tools, and workshops to help members with behavioral health, cancer, catastrophic injury, chronic conditions, LGBTQ health needs, musculoskeletal conditions and pain management, stroke, and the transplant process. For additional information, you can go to blueshieldca.com/shield support. Nurse Help 24/7 offers immediate answers to your healthcare questions. The lines are manned by registered nurses who are available 24 hours a day to answer any of your healthcare questions, including concerns about symptoms you are experiencing, minor illnesses and injuries, chronic conditions, medical tests and medications, and preventive care. For more information on this program, you can go to blueshieldca.com/nursehelp. The Away from Home Care program offers students, long-term travelers, and family members living apart access to health care from Blue Shield and Blue Cross plans across the country. The Away from Home Care program is available in 29 states and the District of Columbia, but availability varies by county within each state. Members using Away from Home Care services outside of California will receive the benefits offered by the host plan in the state they are visiting. To learn more about this program or to speak to a customer service representative, please call 800-622-9402. Now let's chat about a couple of exclusive programs that are available to Trio members only. The first is a non-emergency transportation service for members recovering from a serious illness. It offers reliable transportation to and from medical appointments. Eligibility is determined by a Blue Shield case manager. The second is a free meal delivery service which offers convenient and nutritious meals during recovery from a serious illness. These meals are prepared and geared towards special dietary requirements. Eligibility and meal service delivery frequency is determined by a Blue Shield case manager. For information on either program, you can call the Shield Concierge team at 855-747-5800. Now let's take a look at the PPO plan. SFHSS members have the option of selecting the Blue Shield of California PPO plan. The PPO plan benefits remain the same from 2024 to 2025. The PPO plan utilizes the Blue Shield of California PPO network. You do, however, have the option of using an out-of-network provider for a higher cost share. This allows you the option to see any doctor of your choosing, both in and out of Blue Shield's network. Members may self-refer. There's no need to see your primary care physician first. Members have access to virtual health care via Teladoc. Members have coverage for medical care across the United States for urgent and emergency care anywhere in the world. And newly added effective 2025 is Blue Shield Connect, which includes access to customer service representatives and a dedicated care manager who are here to assist you with any questions you have, including help finding a doctor, finding treatment options, authorizations, setting health goals, and coordination of care. Taking a high-level look at the benefits for the PPO plan, you'll see the benefits remain the same from 2024 to 2025. The Blue Shield of California PPO plan is a co-insurance-based plan with a deductible which must be met before Blue Shield, as the plan, pays anything. The deductible for an individual is $250 and $750 for a family in-network, or $500 per individual and $1,500 for family out-of-network. PCP, specialists, outpatient surgery in a hospital, and inpatient hospitalization are all 15% in-network after the deductible has been met, or 50% out-of-network after the deductible has been met. Chiropractic and acupuncture services are both 50% up to $1,000 max per member per calendar year after the deductible has been met. For prescriptions, retail copayments are $10 for Tier 1 drugs, which are mostly preferred generic drugs and some brand drugs, $25 for Tier 2 drugs, which is mostly preferred brand drugs and some generic drugs, $50 for Tier 3 drugs, which is non-preferred generic and non-preferred brand, and $50 for Tier 4 drugs, which are specialty and high-cost drugs. As previously discussed, HSS has chosen to replace Accolade with Blue Shield Connect. Connect puts a team of nurses, health coaches, social workers, and other specialists by your side. This includes a dedicated care manager to help you support you and find ways to manage your health, all at no additional cost. Connect to a healthier you. To get started, you just call 888-499-5532. Next, let's chat about an exclusive program available to PPO members only. Brightline is available to PPO members only and offers virtual coaching programs for children with licensed behavioral health professionals from 1.5 years to 18 years of age. There are no wait lists, video visits with expert therapists and coaches, programs proven to help work with kids and teens, and support for parents and caregivers too. For more information, you can go to hellobrightline.com/BlueShieldCA or by calling 888-224-7332. Next, let's talk about mental health benefits and resources available to all three plans. Mental health benefits and resources are available via digital programs such as Headspace and Headspace Care, which is formerly Ginger, via Wellvolution, virtual care via Teladoc, Nurse Help 24/7 and Life Referrals 24/7, and in-person care via the Magellan Network for Access Plus and Trio members and the Blue Shield of California Network for the PPO plan. For Access Plus and Trio members, Magellan is focused on recruiting specialty groups with innovative delivery methods to meet members' needs and improve healthcare. Such groups include Charlie Health, Growth Therapy, June, Equip, Talkiatry, Bicycle Health, Rhea Health, and Headlight. PPO members have behavioral healthcare options such as self-care digital programs and virtual care, which are Wellvolution, Credible Mind, Teladoc Mental Health, Life Referrals 24/7, and Nurse Help 24/7. They also offer the traditional network. Inside of California, members have access to Blue Shield's provider network of over 20,000 behavioral health clinicians and facilities. In-person and virtual options apply. And outside of California, members have access to over 34,000 behavioral health providers through the National Blue Card Network for in-person or virtual care options as well. Credible Mind is your virtual health resources hub. It offers articles, videos, podcasts, and newsletters. You can take a well-being assessment on a variety of topics, including stress, depression, anxiety, and more. You have access to crisis resources and hotlines. You can explore Blue Shield mental health services and programs, and you can find a mental health provider. To access, just go to blueshieldca.com/mental health. Now let's discuss pharmacy, the microsite, and additional programs available to all 3 plans. Blue Shield of California will be offering a new and improved pharmacy experience effective 1/1/2025. This new experience will offer a redesigned pharmacy hub, which makes it easy for members to manage prescriptions. It will also offer a side-by-side drug comparison, which will guide members to the lowest cost drug option. And it will offer notifications for members who have opted in to know when a lower cost drug option becomes available. Retail pharmacies will still include the major chains, including Safeway, Vons, Costco, and CVS. It will offer a 30-day supply and a 90-day supply of maintenance medications. Mail service will now be offered through Amazon Pharmacy and will include a 90-day supply for maintenance medications for the cost of only 2 30-day copayments. The specialty pharmacy for the 30-day supply for specialty medications will remain CVS. SFHSS members will also still have access to a microsite at blueshieldca.com/SFHSS, which will include an overview of Blue Shield plans, links to find network doctors, plan benefit documents, and details on programs and services. To find doctors, specialists, hospitals, and pharmacies, Access Plus members can go to blueshieldca.com/network HMO. Trio HMO plan members should go to blueshieldca.com/trio SFHSS. PPO members within California can go to blueshieldca.com/network PPO. And for PPO members outside of California, you will go to provider.bcbs.com. You will enter your location and you can browse a list of plans to find doctors that are in network in your area. SFHSS members can get 24/7 support for a low or $0 copayment from Teladoc. Teladoc Health doctors can treat many medical and mental health conditions, including cold and flu symptoms, allergies, respiratory infections, sinus problems, depression and anxiety, and grief and stress. To request a consult, you can visit blueshieldca.com/Teladoc or go on the Blue Shield mobile app. SFHSS members are also offered Maven, which provides virtual care support for if you are pregnant and up to 3 months postpartum. It offers on-demand virtual appointments with practitioners in more than 30 specialties, doulas, mental health specialists, and baby sleep specialists, care advocates to answer questions about your pregnancy, virtual maternity classes, support for pregnancy losses, resources to plan and prepare for a return to work after maternity leave, and support for family members. For information on this program, you can go to blueshieldca.com/maternity. SFHSS members have access to Life Referrals 24/7, which offers answers to simple questions like quick ways to de-stress or how to find more time in your schedule, to more difficult issues like finding support after the loss of a loved one. Life Referrals 24/7 is here for you. How it works is you can call Life Referrals 24/7 to speak with a specialist ready to assist you with your personal needs. Or you can visit Life Referrals 24/7 online for tools, articles, resources, and more. When SFHSS members are experiencing an illness or injury that is serious but not an emergency, consider visiting an urgent care center to receive care that is typically faster and costs less than an emergency room visit. To find an urgent care center, visit blueshieldca.com/FAD and select urgent care. All SFHSS members have access to transgender benefits, which follow the World Professional Association for Transgender Health's WPATH standards of care, which include providers who specialize in gender-affirming services, gender reassignment surgery, hormone therapy, mastectomy, breast reduction, breast augmentation, associated surgeries and services as agreed with the treating provider, such as facial reconstruction, chin augmentation, lip reduction or enhancement, etc. A case manager is assigned to help navigate the healthcare system. You can learn more by visiting blueshieldca.com/LGBTQIA-health or blueshieldca.com/gender-affirming-care. Lastly, let's talk about Wellvolution. Wellvolution is your online hub to find the right virtual health program to support you and your health goals. Whether you're trying to lose weight, stress less, or even just increase your longevity, there is something for everyone on Wellvolution. We offer programs around emotional well-being, diabetes prevention, diabetes care and hypertension, weight management, tobacco and vaping cessation, and physical therapy and fitness. Enrollment is easy, and customer service is available on the platform. How does it work? Well, number one, you create a Wellvolution account. You visit wellvolution.com to get started. They'll confirm that you're qualified to receive the program at no extra cost. Number 2 is you get your programs. Pick one or more health goals you'd like to work on, and they'll recommend the best programs for your needs. You can make your choice and get started. And number 3, become a healthier you. With the assistance of your program, begin making healthier choices about diet, exercise, sleep, stress, and your overall health. And again, customer service is available on the Wellvolution platform via instant chat, email, and telephonic support at 1-866-671-9644. New to Wellvolution is the Blue Zones Challenge. The Blue Zones lifestyle is a healthy and sustainable way to lose weight. It's shown to reduce risk of chronic disease such as heart disease, stroke, cancer, and diabetes. Participants even report more energy, sleeping better, and feeling less stress. What's included is Eat the Blue Zones way without dieting. Set up your surroundings to support you. Strengthen and build your social life, and reduce stress and boost happiness. Also new to Wellvolution is musculoskeletal health goal, fitness, and physical therapy. For low acuity, they offer general mobility via Sworkit. For medium acuity, it's a visual learner via Kia. And for high acuity, it's needs device coaching via Sword. Wellvolution also offers Virta Health Type 2 Diabetes Reversal Program. Virta Health is a digital clinical program designed to reverse type 2 diabetes substantially. Health risk requirements to enroll include type 2 diabetes and a BMI of 25 or more. The program is at no cost to members and includes physician-led care team, a daily one-on-one support from a dedicated health coach, personalized carbohydrate tolerance levels and diet plan, glucometer and diabetes testing and supplies, and a personal Fitbit. Also included in Wellvolution is Headspace. Headspace offers guided meditations, sleepcasts, music playlists for focus, sleep, and dance breaks. The coaches are of diverse ethnicities and genders. It includes a library of 500 plus meditations on everything from stress, sleep, grief, resilience, to compassion, tension releasing workouts, relaxing yoga, focus music playlists, and more. Meditations are guided and can be 3 minutes to more than 20 minutes depending on what your need is and what you choose. Headspace is available in 5 languages, including Spanish, English, Portuguese, French, and German. Mental health is critical to your overall health. Headspace helps us look after our minds. Headspace Care is also included with Wellvolution. Headspace Care is an app-based and virtual care licensed medical provider. Behavioral health coaching offers members day-to-day support. The app includes a self-care library with interactive experiences that help members learn about and practice the valuable skills needed to manage stress, anxiety, and other day-to-day challenges via guided meditations, breathing exercises, recorded classes, and more. 80 to 85% of members have their needs entirely met by coaching. There is no copay for coaching services. Psychiatrists stand ready to support those in need of additional care, including prescribing medications. Health plan benefit designs dictate the member copays for virtual consults with clinicians. SFHSS has a $25 office visit copay for mental health. That copay applies for virtual consults with Headspace Care clinicians. Thank you for taking the time to attend this presentation. Should you have questions regarding this information or any other plan benefit items, you can always access this information at blueshieldca.com/SFHSS.
Hello and welcome. To find your healthy place, you and your family need high-quality care that is simple and personalized. At Kaiser Permanente, we're both a care provider and a health plan which makes your life easier. Today, I'll be highlighting our integrated quality care, digital care options, and membership perks. This shared information will help you select with confidence the right health plan for you and your family. Before we start, please tell us what you think. We invite you to complete a 3-question survey at the end of the presentation, which will take less than a minute to complete. Now, are you ready to get started? Great, let's begin. Kaiser Permanente provides high-quality care designed for your total health. That includes care for routine checkups, complex treatments, and mental wellness, and care for building strength, reducing stress, raising a family, and new goals. No matter what your priority is, ours is providing excellent care when and where you need it. We can help you get to your healthy place no matter where it is. We combine care and coverage, which makes us different than your healthcare options and gives you peace of mind. With us, you get connected care. What this means is your doctors, pharmacy, and lab are connected to each other and to you. Through our electronic health record, they can see your health history such as your conditions, medications, and allergies, making it more convenient for you to get the right care when you need it. At most of our facilities, you can see your doctor, get a lab test or an x-ray, and pick up prescriptions, all without leaving the building, making your care feel easier, faster, and centered around you. Now let's go into more details about the Kaiser Permanente plan options available to you, including high-level coverage amounts. You can choose from the following medical plan options. Now let's take a closer look at the high-level coverage amounts of your plan options. For specific information about your covered health plan benefits, limitations, and exclusions, please review your evidence of coverage or speak to your benefits administrator. If you need additional time to review this information, press the pause button in the lower left-hand corner of the screen at any time. Here is an overview of the plan option being offered to you. At Kaiser Permanente, your personal doctor is your best health advocate. They coordinate your care with a multidisciplinary care team and make your health their top priority. Our industry-leading preventive screening rates help your care team catch problems early. And if you mean specialty care, your team can connect you with specialists in one of the largest multi-specialty medical groups in the country. If you have a condition like diabetes or heart disease, you're automatically enrolled in a disease management program for personal coaching and support. Every contact with your care team is recorded on your electronic health record, which you and your doctors can access and review anytime, anywhere. This ensures that every caregiver you see has a full picture of your health, without you having to repeat your story. From virtual care, video, and phone visits to in-person appointments, you can choose how, when, and where to get care for you and your family. Plus, stay on top of your care 24/7 with the Kaiser Permanente app or at kp.org. If you prefer to visit in person, same day, next day, and weekend appointments are available at most locations, and many facilities have labs and pharmacies in the same building. Because your mental health and lifestyle are essential to your total health, Kaiser Permanente includes many resources for self-care at no extra cost. Get reduced rates on in-person fitness classes from ClassPass and access to 4,000 plus on-demand video workouts at no additional cost. Kaiser Permanente doctors have one priority: your health. Your personal doctor is your best health advocate. They coordinate your care with a multidisciplinary care team and make your health their top priority. Our doctors and caregivers reflect the diverse communities we serve and provide culturally responsive care in many different languages. Your care team also uses your electronic health record to help you schedule checkups and tests. When you need care, you can talk to a clinician in person, over the phone, or by video. Same day, next day, and weekend appointments are available at most locations. You can also get advice 24/7 over the phone and online through an e-visit at no cost, saving you time and money. Telehealth services are not an add-on at Kaiser Permanente. They're covered at no additional cost by most plans and have been a part of how we deliver personalized care. If you prefer to visit us in person, it's easy to schedule an appointment at a location near you. No matter where you are, your Kaiser Permanente care team can see your medical history on your electronic health record, so you never have to repeat your story. And because services are connected, many Kaiser Permanente facilities have pharmacies, labs, and other services all in the same building, so you can get more done in fewer stops. It's easy to refill prescriptions in person, over the phone, online, or on the Kaiser Permanente app. You can have most delivered to your home with same-day or next-day delivery, or order your prescriptions for same-day pickup. Get refill reminders or alerts when new prescriptions are available to order via text, mobile app notifications, or email. You can also place some orders by responding directly to our text message reminders. We'll provide status updates via text or email about shipping, delivery, or pickup information. Since keeping you safe and healthy is our priority, you're covered for emergency and urgent care anywhere in the world. You can also get urgent care at Minute Clinics, located in select CVS and Target stores, the Little Clinic locations, or Concentra Urgent Care Centers when traveling outside a Kaiser Permanente area. If you seek urgent care at a Minute Clinic, the Little Clinic, or Concentra Urgent Care Center in a state where Kaiser Permanente is located but are outside one of our service areas, you'll be asked to pay upfront for services and need to file a claim for reimbursement. To make getting care while traveling more convenient, there's the Away from Home travel line available 24 hours a day, 7 days a week. kp.org/travel is a special section of our website that's focused on getting care while traveling, and you'll have the ability to refill eligible prescriptions early in preparation for travel. When you're dealing with a serious health issue, your health becomes the center of your world. That's why you're at the center of everything we do at Kaiser Permanente. We're known for catching potential problems early with our robust preventative screening rates. If you do have a condition that needs more attention, you get excellent care from top-notch doctors across a wide range of specialties, including cancer care. Hearing that you have cancer can be overwhelming, but no member or doctor goes it alone. A multidisciplinary team of cancer specialists works with you and your family to determine the best approach to your treatment. Our experienced specialists combine earlier detection, cutting-edge research, and compassionate care. And we have access to groundbreaking clinical trials and other cancer research. We know that no two hearts are alike. There are many types of heart disease, and different people need different types of care. From initial diagnosis through treatment and into recovery, you and your doctor will make decisions about your care together, and you'll have guidance and support at every step. Through evidence-based treatments and comprehensive care and support, we help many members with heart disease live longer, healthier lives. In fact, Kaiser Permanente outpaces the nation in reducing deaths from heart disease and stroke. And our approach to prevention helps others avoid heart disease altogether. Personalized maternity care makes having your baby with us a unique and special experience for you and your growing family. Your dedicated prenatal care team will help keep you and your baby healthy and empower you to make decisions. You can add a midwife to your team too. Create a personalized birth plan of how you envision your day, and we'll help you have the safe and positive experience you want starting with your first appointment. You're cared for and supported at every step, from virtual and in-person tours of our private birthing suites to classes and online resources to help answer the many questions of expecting parents. Support doesn't stop at delivery. We offer breastfeeding consultation and other guidance to help your baby have a healthy start in life. Keep in mind classes vary by location, and some classes may require a fee. Your mind and body are connected. What you think, feel, and do affects your total health, and we are committed to caring for the whole you. We provide clinical and support services for a wide range of conditions, from stress and anxiety to drug dependence and autism spectrum disorders. Our mental health includes psychiatrists, psychologists, as well as family therapists, licensed clinical social workers, and addiction medicine physicians. And as a Kaiser Permanente member, you don't need a referral for mental health care. We also provide members with tools and resources to process self-care like guided meditation and wellness apps. Now let's see how we are using technology to give you more convenient ways to get care. Here are some of the wellness resources to help you stay healthy once you register at kp.org. Get reduced rates on in-person fitness classes from ClassPass and access to 4,000 plus on-demand video workouts at no additional cost. Join a program to help you lose weight, reduce stress, quit smoking, and more at no additional cost to members. Find helpful videos and articles, health calculators, podcasts, recipes, and more. Lastly, get one-on-one guidance and support from a dedicated wellness coach who can help you set goals, stick to them, and, most importantly, see results. And you can do it all from the comfort of home. Partnering with a wellness coach can help you manage your weight, reduce stress, quit tobacco, eat healthier, and increase activity. As soon as you join, we want to make your care experience easier. We provide personalized onboarding with a welcome call and a member guide, so it's easy to get started. You can also visit kp.org/new member to get registered, choose your new doctor, transition your care and prescription seamlessly, and schedule your first appointment. If you still have questions, we are here to support you. Choosing a health plan is a big decision, but you don't have to make it alone. We're here to answer any of your questions so you can make an informed decision. If you have more questions, call the number listed on the screen.
Thank you. This completes our presentation. May you live well, be well, and thrive.
Thank you, everyone. And now we're going to go into the Q&A session. I am just heading back up to the first few questions. so we can do them in order. And thank you. I see my plan reps are already coming onto camera. Okay, is Stanford Hospital covered under Blue Shield Trio? Adam, could you help?
No, it is not. It's covered under the Access Plus and the PPO only. It is excluded from Trio.
Great, thank you. Is Blue Shield Trio an option in Riverside County, Palm Springs?
Yes, it's available in Riverside. In most counties, we do consider partial coverage, but I did look up Palm Springs, and it is covered in all zip codes for Palm Springs.
Okay, and I'm not familiar. Is Eisenhower an approved hospital?
I looked up Eisenhower, and it is not a hospital that's available in any of our networks.
Okay, HealthNet Canopy, does that ring a bell for your hospital network?
Jessica, for HealthNet, it's just a Bay Area network, so there wouldn't be any coverage or any network in Southern California unless it was like an emergency or urgently needed care.
Okay, thank you. And what's the website to check HealthNet Canopy in-network doctors and hospitals?
So that would be www.healthnet.com/SFHSS. And then once you're on that landing page, we have an enrollment. Well, we have a banner at the top and it'll read enrollment among some other ones. But if they click on enrollment, that'll drop you down to the provider search.
Great. And okay, now, sorry, I can see that some of the questions have been answered here. I'm going to see if I can find oh, I see someone had a follow-up. Which facility is covered in the Palm Springs area for?
Yeah, it's, they were asking about the Eisenhower. For Palm Springs, it's Desert Regional Medical Center is the hospital in Palm Springs. That's under the Trio.
Okay. And then, yes, you can, of course, schedule a one-on-one consultation. I'm sure the links have been shared. Is Walgreens still within the Blue Shield network? We've been getting that a lot today.
It is, yes.
Oh, I think someone else is saying there are some meetings there's not enough one-on-one consultations, or that this week is all booked up.
I will go out there and look, but I don't know offhand, so I'll check into that.
Okay, great. And we've got Teresa asking if this was discussed, but what was the difference between Access Plus and Trio?
So Access Plus and Trio, the benefits are identical. The only difference is the network. Trio is a subset of the Access Plus network. Basically, if you want to look at it, the biggest difference is there is no Sutter in Trio.
Thank you. And Palo Alto Medical Foundation, I believe.
Correct. That's Palo Alto Medical Foundation, Mills Peninsula, Stanford. Those are all not in Trio because they're all considered center facilities.
Thank you. And then for Blue Shield Access Plus HMO, how does it work if they have an emergency outside of the United States?
Basically, if you're having an emergency, no matter where you are, outside of California or outside of the country, if it's a true emergency, you chest pains, broken bones, stitches, that kind of thing, we definitely want you to go to the nearest emergency room. What'll happen out of the country is most likely they will have you pay the bill in full before they will discharge you. What you'll need to do then is get an itemized bill translated into English. And when you come back to the United States, you would just file a foreign claim with that itemized bill, and you would get reimbursed the money that you paid, less any co-pays or co-insurance or deductibles. And you can always contact customer service to help them to have them help you with file that foreign claim.
Great. And Vivian wants to know, is Blue Shield PPO an eligible health plan for health savings account contribution? So Vivian, our Blue Shield PPO is not a high deductible plan that usually is what goes hand in hand with the health savings account, and HSS does not offer any health savings account. What we have is a flexible spending account that you can use for your copays, coinsurance, for approved medical expenses, medical, dental, vision, things like that. And then we have, may I know where I find information, which one is covered, or how to use the insurance outside the country during emergency? So this is broad. Could all our plan representatives answer what happens if a member has an emergency outside of the country? I know Blue Shield, you had just answered that.
Yeah, Jessica, you know what? I'm going to say Adam took the words out of my mouth. So very similar process for HealthNet. So as you mentioned, you'll likely have to pay out of pocket, translate all the documents, and much like Blue Shield, we also have a foreign claim form that a member would just fill out, submit, and then they get reimbursed everything minus any cost share that applies.
Thank you. And Canabaya?
Yes, so for Kaiser Permanente, you would bring back all of your bills and everything and submit a claim. And then it's basically the similar process, but I believe we have our own translators in-house, so we would do all that in-house to get that claim paid.
Okay, thank you. And then I've got a question from Kevin. I'm a non-Medicare retiree living in Nevada. Do I need to enroll in a BCBS plan, or is it automatic? The only plan that the health service system has available in Nevada is the Blue Shield PPO plan for non-Medicare members. And it's not automatic. You should always make sure, if you're not already enrolled in Blue Shield PPO, you should go into, this is the time to check your enrollment, and you can make that change. Fitness deals. Is basic vision included for Kaiser dependents with Kaiser? So our VSP basic vision is included in all of our medical plans. Routine eye exams covered.
Yeah, so for anyone on Kaiser Permanente, your basically your routine exams are covered at no charge. So if you want to go get your eyes checked with Kaiser Permanente and then get your hardware with VSP or whatever is your glasses and hardware covered through, you can. So you can go to Kaiser for your exam and then do your purchasing and all that under the other plan that you all have for vision.
Thank you. And then, do any of our plans provide egg freezing? And I believe all of our plans do. Adam, do you want to start and explain how a member can obtain IVF services?
Yeah, all three plans that are offered, the Access Plus, the Trio, and the PPO, all of them offer cryopreservation. They offer 1 egg retrieval and 1 year of storage per lifetime. But it is offered at all three plans.
And I believe it's covered at 50%, correct?
Correct.
And then Kaiser?
Hi, so this is Iris. I'm looking at the EOC, and I'm looking at, just want to be very clear about how I answer the question. So for elective cryopreservation services prior to cancer treatment, it's covered to have egg retrieval and sperm retrieval once per lifetime. And then it says fertilization of eggs. And then it says up to 12 months of cryopreservation of eggs and sperm. So that is specific to cancer treatment. And then assisted reproductive services, those are definitely covered, and it's 2 cycles per lifetime. But that we're talking about cryopreservation for embryos. So it gets a little bit tricky. So I want to be clear whenever we start answering questions like that. It takes a little bit more looking at the details. So I just want to be very specific. I think I'd need a little bit more time to look at the details of the plan. Does that make sense? I don't want to mislead anyone. I don't want to answer anyone incorrectly.
Could you share how a member could get started if they're within the Kaiser system?
Absolutely. So they would make an appointment, of course, with their OBGYN, and their OBGYN, if they are experiencing difficulties with getting pregnant, their OBGYN would refer them to a specialist, and that specialist would then determine whether or not they fit the criteria to move forward with IVF and assisted reproductive technologies.
Thank you. And Fred, how does HealthNet cover that, and how can a member get started?
Yeah, so once again, Adam's I should have him answer all my questions, but so very similar, right? We have, I think there's parity across all the plans, is my understanding, but I think the key, as the Kaiser Health Plan rep mentioned, is this is all, an HMO is a gatekeeper model, so starting off with the primary care physician is always going to be the key, because that'll kind of start the chain reaction of the care. Cryopreservation is covered under HealthNet as well. And it is a 50% co-insurance.
Thank you. And is UCSF still covered under Canopy Care HealthNet?
It is, but Emma, I will keep me honest. I believe that is 100% accurate.
Yeah. Great. And mail order pharmacy, Amazon Pharmacy accepted by all plans. Let's start with Blue Shield.
The Amazon pharmacy piece that we talked about in the presentation is going to be the new mail order pharmacy for Blue Shield. I don't know if it's on the other plans, but we will be moving from CVS Caremark to Amazon. If you currently have a mail order prescription you're receiving, you will be receiving a letter that's going to tell you how it's going to transition and if there's anything you need to do.
And that's for Trio, Access Plus, and PPO.
All Blue Shield plans, yes.
Correct. And great. And Kaiser will not be using Amazon Pharmacy. Is that correct?
Correct. We have our own pharmacy. Unless you're traveling and there's no Kaiser Permanente pharmacy in the proximity, then we'll send your prescription to whatever pharmacies near you, but we're not going to use any third party as of right now.
Great. And Fred, for HealthNet?
For health, yeah, we don't use Amazon, so it'll still be CVS for HealthNet. So either CVS Caremark for the mail order, or if it's a maintenance medication, the members can get a 90-day supply at a retail CVS pharmacy.
Great. Now for Trio, Adam, if I travel outside the Bay Area and need medical care that's not emergency, what options do I have?
Basically, when you're in HMO, you have a service area and your primary care physician and your facilities are in that service area. If you travel outside of your service area, you would once again only be accessing your emergency benefits, urgent or emergency. However, if you're going down to Southern California for any length of time on vacation or to visit family, and you're going to be down there for a while, you can change your primary care physician to an in-network physician where you are that are available, and then you can access your full benefits. But if you're just traveling and you're not staying anywhere for any length of time, you would, the same thing, it's emergency and urgent benefits only.
Thank you, Adam. And what about virtual care?
I'm sorry, were you asking me that?
Yeah,
Yeah.
I believe that's also
Virtual.
an option, correct?
Yeah, virtual care can be accessed anywhere. Through Teladoc. Okay. Or, all you'd have to do is make an appointment and they'll contact you.
Great, thank you. And then for HealthNet, what's the coverage outside of California and outside of the country?
Yeah, so I think very similar, Jessica, to how we mentioned before. So again, out of the country, members pay out of pocket, likely have to get everything translated, and then they submit a foreign claim form, and then they get reimbursed for anything minus the copays. If it's outside of California, the resources so routine care wouldn't be covered. It would just be emergency or urgently needed care. And because it's in the continental United States, I wouldn't anticipate there be any issues with a member having to fill out any forms because they could electronically bill HealthNet for any claims. So, but if a form is required, then we do have a standard claim form that members can fill out in that scenario. And then similar to it, Adam mentioned about Teladoc. So Teladoc could be accessed anywhere. So if a member is outside of California, they can access that virtual care platform. And in some cases, maybe their primary care physician, they may have a capability to also offer virtual care. So they can schedule a virtual appointment with their actual PCP as well, if that's available through their PCP office.
Thank you, Fred. And so we are at time. I see just a few more questions, so let's just try to get through them real quickly. Okay, one question is actually 3 questions for Blue Shield. Adam, you ready for this? Is Blue
I'm
Shield
ready.
available in Oregon?
Only the PPO.
Great. Chiropractic acupuncture is offered under Blue Shield, but I don't see massage. Do you know why? Can we have massage under the wellness programs?
Currently, massage therapy is not a covered benefit, and I do not believe it is under the wellness either. It is just not a covered benefit.
But I'm not sure if you have those discount programs.
We do have wellness discount programs, yes, and you can check online at blueshieldca.com and go under the discount programs to see if there are discounts. Sometimes they'll offer 20%, but it is not a covered benefit.
Great. And I guess this person also has a student overseas, like Canada. How could they require students outside of the state of California and the country to have their own health insurance?
The only way they could access the benefits being out of the country, even as a student, they would have to move to the PPO plan. And if you want to move your dependent there, you all have to move to the PPO. But that's the only way they could access and have coverage outside of the country. I mean, if they stayed on the HMO, they would only have access to emergency benefits.
Great. And then there's a question about Stretch Lab for stretching services. Could all plans answer?
We do have under Wellvolution, we have the new musculoskeletal program that's being offered, and they do have some stretch labs through that. So you could go into Wellvolution, register, and then you could fill out the questionnaire, and it will lead you to those programs.
Great. And Kaiser or Fred, you were about to, do you have a stretching?
Yeah, is that I've never heard that term, but I assume that's the same as like musculoskeletal. Is that a fair statement?
I think
That's
Stretch
what
Lab.
I'm assuming.
Okay. Well, I'll look that after this, but I mean, we do also have Wellbe. So Wellbe is HealthNet's version of musculoskeletal care. Anything related to pain for body parts, as well as if members considering surgery. So that platform that we offer, Wellbe, that supports that type of need for members that are looking for, musculoskeletal support. So again, whether it be back pain, leg pain, shoulder pain, anything having to do with pain, body parts that could potentially lead to surgery or making a decision if surgery is the right thing to do. That's what that Wellbe platform would be for.
Great, thank you. And Kaiser, do you have a stretching service?
So we do offer the Calm app for our members, and they do have a daily stretch move, and they do have some exercises there that people can do. So I would recommend you start off there, and if you need extra support, maybe contact your PCP and then work with them to get a plan, because I do know we have some sort of physical therapy via an app, but that's like once you've talk to your doctor and if that's something that they need. So the Calm app is great for any stretching, and we like to incorporate those in our like meetings that we do, and it's really nice because it's like 5 to 6 minutes, so you could just do it at home at once an hour if you need to. So yeah, I recommend the Calm app for that.
Great, thank you. And for Blue Shield, Adam, can virtual doctors prescribe medicine?
Yes, they can. There are certain medications they can't prescribe. They cannot prescribe things like controlled substances or narcotics. But if you have a cold and they want to give you like a Z-Pack or Theraflu or something like that, they can't prescribe those medicines. Yes.
Great, and that is all that we have time. Thank you so much to our presenters, and thank you all for joining and asking your wonderful questions. We really appreciate you joining today. Please let your coworkers know that we have more presentations and more webinars coming up. And with that, I'm going to end the session. Thanks.
Thank you.
Thank you. Take care.